The FDA says more than 1 million people could be tested for coronavirus by the end of the week.
And state labs, including the Wisconsin Lab of Hygiene, are now able to do their own testing. Madeline O'Neill has a look inside that process and how it may be expanding. Maddie?
Well, Eric and Charlotte, state labs like ours in Wisconsin being able to do their own testing has expanded testing capacity nationwide. Currently, just one novel coronavirus case is pending here in Wisconsin, with one recent case coming back negative. The state hygiene lab has already begun its testing and is preparing for more in the coming days. Here inside the Wisconsin State Lab of Hygiene, the Communicable Disease Division has had a busy few weeks.
Quite busy.
Gearing up to do their part in handling the novel coronavirus outbreak.
We do have a front-facing gown, 2 double gloves, and an N95 respirator that our microbiologists use.
Now virologists have in-house coronavirus testing on their plate.
So the resulting is faster. If we get the specimen in really early in the day, it's possible we could have results the exact same day. Otherwise, it would be the next day, as opposed to sending down to CDC overnight and waiting for their cue.
What you're watching isn't an actual coronavirus test, but this is what the process looks like after they receive the specimens, which can be more than one from each patient.
The test is called the PCR test, and the first part is extraction of the genomic nucleic acid, basically. And then the second step is amplification, so being able to detect that nucleic acid.
In simple terms, Dr. Alan Bateman says it's very similar to tests done for other respiratory viruses like the flu, with some extra precautions.
So CDC recommends what's called biosafety level 2 protocols, and we meet and exceed those.
Right now, Bateman says his virology team is keeping up with the workload, but they're talking about what the next steps will be if things get even busier.
This virus continues to spread, but it's really too early to tell. We're preparing as best as we can for what might come.
Bateman says the state hygiene lab is talking with clinical labs across the state to help them get ready to do coronavirus testing of their own. Of course, that's another way to expand testing here in our state.
Maddie, thank you.